welcome to Mental Health Matters. I'm Edgar Wiggins, Executive Director of Baltimore Crisis Response Incorporated, and your host for this show that is dedicated to providing you with practical and useful information regarding mental health issues and needs. For some time, there's been tremendous concern about mental health issues in children and adolescents. Today, to try and help us make some sense out of these challenging situations, we have with us a guest who has come to share her expertise in this area. We have joining us here in the studio Dr. Paramjit Joshi, who is a child and adolescent psychiatrist and is an associate professor of psychiatry at Johns Hopkins. Welcome to Mental Health Matters.
Well, thank you very much. I'm delighted to be here.
Let's kind of get started with our discussion today by talking about some of what we see as the common mental health problems or the common mental health concerns that we see in children and adolescents.
Well, perhaps a quick way to divide mental health concerns would be children who have externalizing behaviors, if you will, and these are behaviors, which you would pick up very quickly, a parent would pick up very quickly, and a teacher, such as trouble concentrating, such as behavior problems, or being impulsive. These are things that we readily see in children, and so these are external behaviors that we pick up very quickly. I think where we run into trouble are symptoms of mental disorders in children and adolescents that are internalizing behaviors or symptoms, such as sadness and other feeling states, or anxiety, obsessions, compulsions. And so this is a way to help parents understand externalizing behaviors and internalizing behaviors and symptoms.
Well, when you talk about externalizing behaviors, you are, if I'm understanding you, talking about the kinds of things that children do that really call attention to them. I mean,
correct.
If a child is impulsive, if a child is fighting and has trouble getting along with others, the kinds of things that result in academic performance problems like poor concentration and so forth. I mean, those things are certainly pretty readily apparent. Now, in terms of these internalizing things, and you're talking about sadness and anxiety, I would guess that the children might have some trouble expressing those kinds of feelings, and certainly directly expressing them.
And there's no question about it, especially the very young child. They have trouble with vocabulary. They just don't, they know how they have the feeling, but they don't know quite how to describe it. And so if you ask a 6 or 7 or 8-year-old, they'll say, I'm sad or I'm angry, but there are lots of other sophisticated feelings that we all have, which they have a hard time describing. And so, which is why, actually, as a child and adolescent psychiatrist, you have 2 years of extra training to learn how to be able to communicate with children and adolescents, to help understand how they may be feeling. And, for example, a depressive disorder in a child and a depressive disorder in an adult, even though the symptoms that we look for are the same, the way they present it is quite different. And so you need to know, how to go about asking a child about a mood disorder.
Well, let me ask you a question, because I mean the one thing that's pretty apparent is that if an adult is experiencing a mental illness, and they can put that into words and say that they can talk about the change that. All of a sudden I'm feeling sad, I'm finding myself feeling perhaps moody or irritable, I'm getting tearful, I'm having trouble concentrating. I mean, those are very clear things that the professional can then say, okay, and begin to think about how to diagnose this. How do you ask a child about those kinds of things? What kinds of things might a parent be able to do? Because when I think about it, for instance, one of the things I think about, even in terms of my own children, is how quickly their moods change. Child's happy one minute, sad the next, irritable one minute, angry the next. I mean, how do we begin to understand? Because one of the things we're trying to help parents do is know when it's appropriate, perhaps, to get that professional opinion.
And you're absolutely right. And I think one of the important things is that it's very seldom that a child will seek for help, because they won't even know that something is wrong. So it's always either the parent or the extended family or the school teacher who will bring attention to the parent. You know, I think your child is having some difficulties, or so, you know, the reason a child is brought to a mental health professional, if you will, is not because the child says, you know, I really need help. It's always an adult in the child's life, whoever it might end up being. And when it comes to a depressive disorder, I think what you look for is a clustering of symptoms that occur all at the same time. And you're absolutely right, Edgar. You know, all of our children at some point in their lives, have had trouble sleeping, or with appetite, or, you know, they're irritable and moody. And I think the question that most parents have is, what is normal moodiness of adolescence? And when does it become a mood disorder? And of course, you know, I think when I look at a child in my mood disorders clinic at Hopkins, what I'm looking for, again, is a family history, because really a mood disorder tends to run in families. We do know that. So it's really important to take a very detailed family history. And often what will happen is, I'll have a child who comes for what I call a well baby check. It's because either a mother or a father or someone in the family suffers from a mood disorder. They have learned along the way that it does tend to run in families, and automatically they worry about their child, like you would, you know, if you had, say, diabetes in the family.
Sure, exactly.
And you know, it tends to run in families. And so I call them well baby checks, and I'm always very pleased when a parent actually does that, because they're thinking ahead, and they're trying to access the right evaluation for their child, and I think that's important. So getting back to, you know, when do we say it's a disorder as opposed to kind of the normal variances of just growing up? If there's a positive family history of mood disorder, we know that the child is at risk. There is no question about that. Whether the child eventually develops it, you know, is a different story. But so that's kind of a risk factor. As actually with attention deficit disorder, we do know that that tends to run in families as well, as is anxiety disorders, as is an obsessive compulsive disorder. So I think it's really important when you do a comprehensive evaluation is to take a good family history. And a good family history is not, Edgar, does anyone in your family suffer from a mental illness? You know, by and large the answer will be, I don't think so. And you know, that's what I call a bird's eye view family history, which is really useless as far as I'm concerned. A good way to take a family history is, you know, you identify each person in the family, because then what you're getting the parents to do is to focus on that person for those few minutes, and then they can actually just think about that particular person and say yay or nay, or you know, whatever it may be.
Well, one of the other things that strikes me as well is that when you ask a kind of broad, I mean, it seems specific, but it is a fairly broad, well, does anybody in your family suffer from a mental illness? You know, there are things that, depending on how old the parents are, that we now recognize are in fact indications and symptoms and behaviors of mental illnesses that perhaps, you know, 20, 30, 40 years ago, we weren't aware of that, and the parent certainly may not be aware of that as well. So I think that you're hitting on something that's important. It's essential to get sort of an emotional barometer of what the household was like, you know, is like for the people that are living in that household. And if we find that, for instance, there are these great changes in mood, then perhaps it's almost like we're doing kind of a retrospective assessment.
That's correct. That's correct. In fact, many times what happens is that, you know, we diagnose a certain mental illness in the child, and as you go into the details of it with the child, you know, the parent will say, you know, that's the way I felt when I was young. And it's kind of the backdoor approach to diagnosing mental illness in another family member. And it happens oftentimes.
Well, let me stop you there, because I think that this is extremely important, because one of the other things that strikes me is that although we know there have been some tremendous advances in terms of treatment and psychiatry and community mental health and so forth, we also cannot ignore the tremendous issue of stigma. And so that the further back we go as we try and learn about the families and the family histories, the more we also have to consider that issue because we recognize that stigma is alive and well, and it really is a deterrent to people getting the help that they need.
And there's no question, if you recall, many years ago, cancer was a stigma. I remember growing up, or when I was in medical school, it was kind of a scary word. People would say everything else except I have cancer. And then we went to I have AIDS. And same thing applies to a mental illness. And I think we are much further along than we were even 20 years ago when it comes to the stigma issue. And I think we're all human beings, so when we have important people that we look up to, say like Tipper Gore came out and said, I suffer from a depressive disorder. I think it gives people permission to say, wait a minute here, this is somebody really important. It's, when Ronald Reagan said, I have colon cancer, and then suddenly there was, kind of colon cancers coming out of the woodwork.
Exactly.
And so I think that people that, we look up to, celebrities and just important people in our lives, I think they do a great service when they are able to share.
Well, I think that we're certainly moving in the right direction. I know we've got a lot more to talk about, but we do want to take a short break, and we'll be right back to Mental Health Matters.
This is the story about a group of kids who volunteered.
Doing something nice for someone. We fixed stuff. Did some art projects with the kids. We fixed up his house. We worked in the woods. Cleaned up the park. Did something for the planet. We just did it.
No other reason. And you know what? It was great.
At first, they didn't know each other.
Well, that didn't last long.
This guy is really funny. Me
and Ace are my
new friends.
Are you into it? Call 4-H or check out our website at areyouintoit.com.
In nature, we see reflections of our children. The tree is the strong one, the ocean rambunctious and untamed. Like our children, each brings something wonderful and unique. They add color, they bring life. And to choose the sky over the water would be like choosing one child over the next. EarthShare, the world's leading environmental groups working together. To learn how you and your employer can help, visit our website.
Welcome back to Mental Health Matters. We're continuing our discussion regarding child mental health issues with Dr. Joshi, who is a child and adolescent psychiatrist and an associate professor at Johns Hopkins. Now, before our break, we were talking about how parents and other caretakers can begin to recognize that there are problems that may, in fact, need the evaluation of a mental health professional. Can you say a little bit more about that?
Well, when you look at a child's life, there are really three domains that we worry about. There is the social life, which is really important, because we know kids have big peer groups and whatnot. There's the academic life, which actually amazingly is the only part of a child's life that's monitored quarterly, if you think of it. And then there's family life. And going back to the academic life, there's a report card at the end of each quarter.
That's right.
So when you look at a child's life, right from kindergarten all the way actually to college, through college, or even graduate school, there's a report card that comes home. And we always worry about our kids' grades, and so if there's a dramatic change, the child is doing fine and suddenly the grades are falling off, and you're getting calls from teachers, which is quite unusual for your child to kind of experience something like that. It's a red flag. And in the home life, if the child is suddenly, I can understand teenagers not wanting to hang out with their parents. I mean, that's okay, it's developmentally all right. But if the